Hi everybody, you are listening to the Medea podcast series. Medea Medical Education Academy is a global medical education provider dedicated to designing, delivering and evaluating medical education programs worldwide. In this episode, we have two important experts, Antonio Lamarca and Livio Casarini, who are going to introduce the upcoming international workshop, How to Master Gonadotrophins in Follicular Genesis, which will take place at Maranello, Italy, on September 27th, 2024. For more information on this event, you can go to the Medea website medeacademy.com/event/workshop-RM 2024.
Hello to everyone. My name is Livio Casarini. I am professor at the University of Modena and Reggio Emilia in Italy. I work in the unit of endocrinology, but I am a basic scientist and engaged every day with my team and study the cell response to gonadotrophins. Now I am introducing to you my esteemed colleague Antonio Lamarca.
Good morning, everybody. My name is Antonio Lamarca, and I'm professor of obstetrics and gynecology at the University Hospital of Modena and Reggio Emilia. And my main research, as well as clinical interest, is in reproductive medicine.
We are presenting now the conference that will be held in Maranello, Modena, on assisted reproduction. The title of this conference is How to Master Gonadotrophins in Follicular Genesis. In Modena, we have expertise in this topic, so we are considered a sort of scientific hub for follicular genesis, or at least this is what we aim to. And we have to organize this conference for a target audience that is biologists, endocrinologists, gynecologists, and obstetricians, nurses, urologists, and also psychologists. This is because science of human reproduction progressed greatly in the last decade, both in the basic and the clinical side. So this conference would be a milestone in the field where recognized world experts will show the state-of-the-art new theories and especially practical guides for assisted reproduction. So this conference is articulated into 4 sessions that now will be introduced by me and Antonio Lamarca. So, Antonio, the floor is yours.
Yes, Livio, thank you. And I agree with all you said. We are organizing an interesting meeting, which is specifically focused on follicular genesis, in particular on early stages of follicular genesis. We're going to talk about factors, recognize the new factors and mechanisms affecting, in particular, the early stages of follicular genesis. During the meeting, we will discuss about the role of FSH and LH in early follicular genesis, as well as sex steroids, AMH, and the new intra-ovarian signaling pathways, which may have a role in controlling ovarian follicles. We think that the recognition of all those mechanisms may, in the end, improve our clinical ability to guide ovarian stimulation cycles in IVF. And we are going to present to the audience new possible strategies to induce ovulation and controlled ovarian stimulation in IVF clinics. We are going to discuss about the role of androgens and the role of AMH, we said, in modulating the ovarian sensitivity to gonadotrophins. Livia, would you add something more on the contents of our upcoming Congress?
Yeah, thank you. Let me say something about the 4th session of our conference and all the speakers that we have invited. The conference is articulated into 4 sessions. In the first one, we will talk about new insights from basic science, which is very important to build a good clinical approach. And we will have the pleasure to host 2 esteemed colleagues. The first one is Francesca Gioia Klinger from Rome in Italy. She will talk about the quiescence and awakening of ovarian follicle. While the second speaker is Professor Nathalie Di Clemente from Paris, France. She is an esteemed expert in anti-Mullerian hormone, and this is exactly the topic of her talk. From AMH to androgens, the role of paracrine hormone in the maturation of preantral follicles.
This session is going to be very, very interesting. We have here two very expert researchers on ovarian physiology. Again, we're going to go in depth regarding the role of AMH and androgens, regarding their role in controlling the growing of ovarian primordial, primary, and secondary ovarian follicles. With Livio, we are investigating the role of AMH in ovarian follicles. So hopefully, we're going to add something to what already known on this topic. In particular, we are showing that LH may have a role in the expression of AMH receptor type 2 on granulosa cells. Livio, do you think we can add something more on this?
I would like just to add that it is a very interesting topic because the first stages of folliculogenesis, at least in my opinion, are really mysterious. It is quite unknown which kind of factor regulate the quiescence and the awakening of ovarian follicles. We have just some hypotheses, a number of molecules that were identified as a possible players, but there are still a lot of studies to be done. So I'm really curious to see what the two speakers will teach us. In the second session, we will give a more clinical view on the topic. It is entitled, What Clinical Evidence is Telling Us? The speakers are Professor Baris Atta from the United Arab Emirates. He will talk about state-of-the-art on actual approaches to couple human infertility, while the second one is Professor Carlo Vigi from Naples. What drugs should be used for ovarian stimulation? A simple guide for clinicians.
This session has a very clinical perspective. We have here to recognize the expert clinicians, Baris and Carlo, both working in IVF setting since many years now. And in particular, Baris will show us as the clinical practice, the IVF clinical practice has changed in the last 20 years. For sure, it will speak about the freeze-all strategy and the pre-implantation genetic testing, while Carlo will talk about old and new gonadotrophins. Nowadays, we have many different drugs, folitropin alpha, folitropin beta, folitropin delta, choline, LH, urinary and recombinant products. And we know that different gonadotrophins are indeed different. While meta-analysis usually shows that the live birth rate, which is the golden outcome of IVF, is not different when using different gonadotrophins, in reality, if we go to look at the ovarian response to gonadotrophin stimulation, in that case, we are pretty sure to find significant differences when different gonadotrophins are used. And Livio and his team has repeatedly demonstrated that in vitro, again, different gonadotrophins act differently. Would you add something on this, Livio?
Yes, indeed. Thank you, Antonio. This is a case session for our conference because they will talk about gonadotrophins, and assisted reproduction is still based on the use of gonadotrophins. We have a lot of commercial compounds that has structural differences, but overall, they were still used, I would say, in an empirical way, but they are not really equivalent. In vitro studies that last for more than 10 years recently showed us that these molecules regulate different effects at the intracellular level. And it is quite difficult, but even interesting to see if these effects that are detectable in vitro impact also the clinical outcome in patients, at least those with a certain genetic pattern or some other clinical characteristics. So I think that this session will be very interesting. The third one is on new insights on folliculogenesis and ovarian functions with the speaker Renato Franchini. He will talk about androgens for pre-treatment of poor responder women. And I would like to point out here what you said before, Antonio, about the relevance of androgens during the folliculogenesis. In the same section, you, Antonio Lamarca, will talk about new theories on ovarian folliculogenesis with a session entitled, "What are the clinical evidence showing some effects of gonadotrophin on early stages of folliculogenesis?" This is a very exciting session, in my opinion, because it challenges the classical view that gonadotrophins has a role only during the antral stage of folliculogenesis.
In this session, we are going to talk about new possibilities when talking about ovarian stimulation. As Livio said, in the past, we thought that gonadotrophins are mainly acting on the so-called gonadotrophin-dependent folliculogenesis, which is the late stage of ovarian folliculogenesis. But in reality, we have some preclinical and clinical suggestion that gonadotrophins may have a role even on the first phase of folliculogenesis, what is usually called gonadotrophin independent folliculogenesis. And with Renato, we're going to show some data clearly indicating that gonadotrophins, in reality, they are promoting the growing of small antral follicles. We are going to show you that in clinical practice, when you have low gonadotrophins, low endogenous gonadotrophins, the rate of progression of follicles is reduced. Women with long-lasting hypothalamic amenorrhea, they may have very low levels of AMH and antral follicle count because they lived for a long period of their life with ovaries which have been insufficiently stimulated by gonadotrophins. On the opposite side, we have women with polycystic ovarian syndrome who are characterized by high levels of LH, and accordingly, you will have very high levels of AMH and antral follicle count. And we think that in particular, LH may have a very relevant promoting role onto ovarian folliculogenesis. The last session is again focused on clinical activity with Barish Atta talking about new ovarian stimulation protocols. In the last few years, we have introduced in the clinical practice new protocols, new strategies, including the random start ovarian stimulation, the luteal phase ovarian stimulation, the so-called PPOS, progestin prime ovarian stimulation. In just 10 years, we have completely changed our way to stimulate the ovary. And Barish has published many original and review articles on this. And for sure, his talk will be so much informative for all clinicians involved in this field. And then Christensen, she has a long-lasting experience with ovarian tissue cryopreservation and transplantation for women with oncological problems. And in particular, in this talk, she will talk about the ovarian tissue transplantation as a model to study ovarian activity. As you can agree, when investigating ovarian function in vitro, sometimes you will have data which cannot be easily replicated when studying ovarian tissue in vitro or in vivo. And so having different models may in the end enrich our knowledge on ovarian physiology. Don't you agree, Livio, on this?
Yes, Antonio, I agree. I fully agree. We have two excellent speakers even in this last section, but let me say something related to what you have recorded now about the in vitro models that are under development We traditionally use single cells that could be obtained by ovarian follicles, or we use also cell lines, are all good models to study how hormones works, and they provide very helpful mechanistic insight on the function of these molecules. But they have a great limitation that are not so representative in certain cases of the real in vivo situation, because in vivo, we have different cells that are influenced by paracrine factors and other molecules released by the environment. So this new model will provide really interesting new data that will allow us to improve the science for assisted reproduction. So I think it is all. Have I missed something, Antonio?
No, you said everything. With all this said, you all are invited to attend to the meeting, and you can register through the website of Medea Academy.
For more information about our workshop, How to Master Gonadotrophins in Follicular Genesis, please visit our website at medeaacademy.com/event/workshop RM 2024.